November is Bladder Health Awareness Month, and joining us now with some important advice on staying healthy is Dr. Christopher Atalla, who is a urologist and robotic surgeon at Catholic Health. Doctor, thank you so much for joining us.
Thanks for having me on the show again.
I'm glad you're here because, I think last time we were talking about the prostate and prostate cancer. This is the first time I feel like we've been talking about the bladder. And the bladder and everything that goes along with it, things like health issues like incontinence, are things people really don't talk about. And so I realized this month is pretty important.
Oh, absolutely. Your bladder is one of those things you don't really think about. You just kind of assume that it works from day to day. And then when there's a problem, that's when it really becomes known to you that, you really need your bladder. And it's a really important thing that when something goes wrong, it really affects your day-to-day life.
What are some of the common health problems that we do experience with the bladder?
So both men and women definitely can experience issues with the bladder. Women, as you kind of alluded to earlier, can have some issues with incontinence, which is a major lifestyle issue. So leakage of urine is definitely one of them. Urinary tract infections or recurrent urinary tract infections is another big issue. For men, and we talked about the prostate before, but really the prostate and the bladder are kind of linked together. And so when there's prostate issues, there can be bladder issues too.
I feel like you realize you have a problem when you have a problem. What are ways to prevent those problems from happening?
So one of the most important things is certainly keeping hydrated, drinking as much water as possible. Listening to your body. Some of us have jobs where it's hard for us to get up and go to the bathroom when we need to, but when your body is saying it's time to go to the bathroom, you should definitely try and listen and go to the bathroom, when it's time to go. And certainly when you feel like something's wrong or something's not right, don't sit on it for too long. Try and address it as soon as possible, because the longer you wait, the worse it could become.
When you talk about drinking water, how many ounces, glasses should we have a day?
So, the recommendation is 64 ounces of water or 2 liters of water a day, which is quite a lot of water. And you're certainly going to feel like you have to go to the bathroom a lot when you drink that much. But sometimes that's kind of a difficult task for patients. And so usually I recommend just trying to increase your general water intake. So if you're drinking 1 or 2 glasses a day, try and do 2 or 3, even 4 glasses, and just cognitively making yourself drink more water. I think that'll be just fine.
By not drinking enough water, what are we doing? How is that hurting the bladder?
Well, it's affecting your bladder and your kidneys too. When you become dehydrated, that makes you prone to getting kidney stones. Certainly can make you more prone to getting infections too if you're not keeping everything flushed. And so drinking water is kind of just good for your overall health too.
Overall health, bladder health, what can we do with our diet?
Dietary-wise, there isn't any specific foods, for example, that you have to eat or stay away from. But just in general, eating a heart-healthy diet is always good for your urinary tract as well. And so staying away from fatty foods, greasy foods, sometimes even spicy foods can affect, the way you urinate. And so if that's something that irritates you, you should try and avoid that.
Okay, and I'm going to go back to the fluids because I heard somewhere that caffeine, like too much coffee, is not good. Please don't tell me that.
We all love coffee, right? And it's always one of the biggest things when patients say, I drink 2 or 3 cups of coffee a day, and I'm not giving that up. So caffeine is not necessarily harmful to your bladder, but the more coffee or caffeine that you drink, the more you're going to urinate. And so caffeine is a diuretic, which makes you go to the bathroom more, which means that you can become dehydrated more easily. So one of the things people don't realize is that you actually kind of have to follow that up with increasing your water intake so that you remain hydrated.
Now, I know we've been talking about some of the issues. Treatments, most of the treatments do not require surgery. What kind of treatments? Most of it's medical treatments or holistic? For urinary tract infections, that kind of thing.
Yeah, so urinary tract infection is typically treated with antibiotics, and usually it's a short course between 3 to 5 days. Incontinence varies depending on the type of incontinence. If it's what we call an urgent incontinence, where you feel like you have to run to the bathroom a lot, that's typically treated with medications. Stress incontinence, which is when leakage occurs with increased pressure on your abdomen, like coughing, laughing, or sneezing. Generally, we try to treat it conservatively first by doing something called Kegel exercises, which is a pelvic floor exercise. If that doesn't improve things, then sometimes surgery is an option to have a sling placed, and patients do very well with that.
Okay. And again, don't ignore problems. If something is changing, you know your body, don't ignore it. Go to the doctor.
Exactly. That's the best advice you can give.
Thank you so much. We love having you on. Your advice is always so great. Thank you very much, Dr. Atalla.